Welcome to our Antenatal Education Class. The following short videos and slides will help answer some of the questions you may have about the changes that happen to your body in pregnancy, the labour stages and pain relief, and what happens once the baby is born. This information will assist you to make birth choices in your birth plan. This generally happens around 34 to 36 weeks. Please speak to your community midwife for further details.
Welcome to the antenatal classes at Chesterfield Royal Hospital. I'm Barbara Reid, I'm one of the community midwives attached to the hospital.
And my name's Carla Richards, I'm another community midwife attached to Chesterfield Royal.
Today I thought we'd look at the different stages of labour and start off by looking at when to go into labour when you're in hospital. A lot of women are quite concerned as to when to go in. Is it actually labour? What is happening? So we thought we'd start off by looking at some scenarios that would hopefully demonstrate if you are actually in labour and what you need to do. Okay, if we can have the first question then, Julie.
Joanne is getting backache. It seems to be coming and going every half an hour.
So do you think this might be it then, that she might be in labour?
She might be starting in labour, I think.
Yes, yeah, it could be the early stages of labour. Have you got any ideas what she should be doing?
A warm bath.
Yeah, a warm bath.
Some paracetamol.
Yeah, that's really good, yeah, both of those would help. I mean, this early stage of labour, things can take their time, but it does often start with a bit of backache or a bit of low period type pain. So yeah, just relax as much as you can. Warm baths, paracetamol would be very good.
And stay at home.
Stay at home, yeah. Okay, shall we have the next question then, Jill?
Jill has not felt the baby move all day.
Our advice would be, if she rang in and spoke to us, would be whatever normal pattern is for your baby's movements should stay that way right up until you have your baby. And it's different for every lady, so it's just whatever you're experiencing. If you're not happy that your baby's moving accordingly to what its normal pattern is, just sit somewhere quiet, have something hot, cold or sugary if you're allowed to, and then if that baby doesn't respond to that within a couple of hours, then you should be contacting your maternity unit. So just give Chesterfield a ring and then you'll be able to discuss it with the midwife. But don't ignore any changes in behaviour.
Emma has just been to the toilet and on the tissue she noticed some mucus with old blood stains in it.
So do you think that might be a sign of labour?
I don't think so, but it doesn't sound very nice.
No, probably isn't very nice. Does it look a bit sort of snotty and mucousy and sticky?
Yeah, it says mucousy and with blood in it.
With blood in it, okay. And was it bright red blood or was it
Old.
brown? Old, okay. So most likely what we call a show. And a show occurs when the cervix starts to change. These changes to the cervix take place towards the end of pregnancy in the last few weeks. And as the cervix starts to change and open slightly, you lose the mucus plug. And that can come away, it can be a week or two before labour, or it might not come away until labour, but it generally is sort of streaked either with old blood or a little bit of fresh red streaking in it. And if it is just a little bit, then we wouldn't worry, and there is nothing really that you need to do, and just carry on as normal.
As long as it's not itchy, it's not red fresh bleeding, and it's not offensive, then it's just something to keep an eye on.
Okay.
Yeah.
I guess following on from that, my question is, Diana's noticed some fresh blood in her pants, about 2 tablespoonfuls.
Any red fresh bleeding throughout your pregnancy, and it's not unusual, and some ladies will think it's part of a show, but any red fresh bleeding that looks like the beginning of a period that's not mucousy, then you should be reporting it to your maternity unit.
My question is, Angie is worried.
Okay, I mean, anything that you're worried about, phone either your community base or your maternity hospital, your maternity unit, and they will give you advice over the phone. What we don't want is for you to be sat at home worrying, because there's always advice available.
Where would we phone it at what time?
Okay, The community bases are up and running in most areas now, and they're open 8 till 4. Some of them are every day of the week, and some are not open Saturdays and Sundays, but there should be a sticker on the front of your notes that tells you sort of when they're closed and when they're closed for lunch and everything. Outside of those hours, the Pregnancy Assessment Centre, their number is on the front of your note, so it will be them that you need to phone. Okay.
Sarah just doesn't feel well. She has a thumping headache and her face and feet appear swollen.
Any signs and symptoms, pregnancy, particularly towards the end, is very stressful and it has a big impact on your systems. But anything unusual for your pregnancy, then you should raise it with either your community midwife at your base, or you can contact the hospital. And if it's not something that the community midwife can address, then she'll advise you what to do from there on. And just record any symptoms that you've got. And if it's just something, just check that, have you not eaten recently, or have you not had anything to drink? It could be big dehydration, low blood sugar, just an early pregnancy swelling is not unusual. So just talk to your midwife and then she'll be able to put your mind at rest, hopefully, or be able to refer you on if appropriate.
Ruth has had diarrhoea today.
Right, I mean, this could be several things. I mean, do you think it could be a sign of labour, or?
It could be. It can happen, can't it, when somebody goes into labour?
Yeah, that's right. I mean, a lot of ladies do sort of empty their bowels and have a good clear out before labour, and it's just the body preparing itself and sort of emptying the bowel so there's more room for the head to come down and everything in labour. So yeah, it could be a sign that she's about to go into labour any day. Could just be that she's picked up a bit of a stomach bug. So what we'd say is just to sort of keep an eye on things, make sure she stays well hydrated, and if it carries on over 24 hours, to contact one of the bases or even the GP, and they might talk to her about getting some extra fluids inside her.
Cindy is having strong period pains every 5 minutes.
That again is something just to keep an eye on. It's not unusual in early labour, and it's not unusual towards end of pregnancy. As long as the movements are all right, there's no fresh bleeding, and it's just monitor the effects of them. Are they long lasting? Are they quite painful? If it's just mild, it's just something to keep an eye on. As long as everything else is all right, as long as your movements, no bleeding, your waters aren't leaking, then it's just something to keep an eye on, and just talk to your midwife if you've got any concerns.
My question is, Sue's knickers are wet.
Right, so Sue's knickers are wet. So have you any idea what you think that could be?
I would think, if it was me, it would be my water set maybe broken.
Yeah, I mean, that's obviously the first thing most people would think about. And at this stage, we're thinking that you've probably not got any contractions. You're at the end of your pregnancy. What colour? Does it say what colour it is or not?
No, it just says the word.
Okay. Colour's very important when we're looking at your waters having gone. It should be a clear straw colour. If it's any darker than that, very dark yellow, if it's a green, browny colour, we need to know. The other thing we need to know about is any blood staining in the waters. So if it is clear, you still need to contact the hospital, but it's very important that you report to the midwives what colour it is and whether you're having contractions or not. Okay. If you're not having contractions, the hospital will leave you for about 24 hours to allow your labour to start naturally, and then if it's not started within that time, we need to think about inducing your labour and getting you going, because obviously a bag of waters is like a protective bag that the baby's in, and once those have gone, baby's more prone to catching an infection, so we just need to get your labour in. Okay?
Yep. Could it be that she's had a wee?
It could be that she's had a wee, yes, that's something else that we'd think about. So it might be that when you phone the hospital, the advice they give you is to put a pad on, see if you continue draining any fluid, because if it is your waters, you will continue to drain. Could just be towards the end of pregnancy that you are leaking a bit of fluid because baby's sort of bouncing up and down on your bladder, and as it's doing that, a little bit of urine's leaking. So it could be that. And the other thing it is sometimes is a very clear discharge. You do get sort of a clear watery discharge towards the end of your pregnancy. But any doubts, phone the hospital and they'll talk to you about what you need to do.
Okay.
Okay, thanks.
My scenario is Sarah just doesn't feel well. She has a thumping headache and her face and feet appear swollen.
If she doesn't feel unwell at all, she should be contacting either a community midwife to discuss it or contact your hospital. If it's a headache, if there's any visual disturbances, if you just don't feel right and you've got a general swelling, then they're all important factors to note, particularly in late pregnancy or any stage of pregnancy really. You should be contacting somebody if you're not feeling well yourself and getting advice, and then we can get you checked over. It could be linked to blood pressure problems. It could just be that you're getting towards the end of your pregnancy. It could be linked to, if you're not eating properly or drinking, but we need to make the distinction and just check that you're well and happy to continue.
Is this what they call pre-eclampsia?
It potentially could be, yeah, but don't worry about it. It's just something that we watch out for, particularly in first-time mums, but not in everybody. It's just something you just need to note if you're just generally feeling unwell, any swelling, general swelling, any particularly visual disturbances, persistent headaches that won't go with a bit of rest and some paracetamol. And if it's different for you, if it's different for your pregnancy and not what you used to expect it, then yeah, speak to a midwife.
Kirsty has been having regular pains and the hospital have told her to stay at home for a while. They feel a lot stronger now and she's a bit frightened by this.
Okay, so obviously she's going to be very frightened. It's probably her first pregnancy. It's something that she doesn't know what to expect and that she's not experienced before. By phoning the hospital and talking to them, the hospital do get a very good idea of how she's coping and if it's time for her to go into the hospital or not. If she's been at home a little while since she last spoke to the hospital and the pains are getting stronger, then it might be an idea that she needs to phone back. A lot of women phone when the contractions are sort of every 5 minutes. Quite a few women at that stage, they'll be told to stay at home, that they're perhaps not ready to go in. A good time is when the contractions are sort of 2 to 3 contractions every 10 minutes or about 3 to 4 minutes apart, just to give your body time to get established and your labour to get established. But as long as baby's active, she's no bleeding, and she's been in regular contact with the hospital and they've told her to stay at home, that's fine. If she feels that she needs to speak to them again, then that's what she needs to do.
Claire's woken at 5 a.m. with backache and tummy ache and the bed's soaking wet.
Again, what is the potential? What might be happening to her?
I think the waters might have gone, or that she might have had a wee in the night.
Yeah, there's no hard and fast rules, and everybody's different. Everybody will experience these things differently, and they can go with a gush, they can go with a trickle, or you can just be a little bit damp. So if you're in any doubt at all, just pop a pad on and then speak to your hospital, and just be aware of the colour and just any other things that aren't quite right at the time. If you anything unusual for your pregnancy. But you should always contact the hospital because they need to pinpoint if they are your waters that they have gone, and we can make a plan for inducing you should we need to.
Will they make her go straight into the hospital then at this point?
I would have thought so, yeah, at that stage. She'd pop a pad on so we can see exactly what you're losing when you get there, and then we'll always speak to the hospital before you go, let them be prepared, and then they can just observe things when you get there, and they can tell you, let us make that distinction of whether your waters have gone or not, and then we can make a plan for you.
Can I just ask how would is there things that they can do to be able to help if you're a bit unsure sometimes? What things might they be able to look at if you are unsure whether the waters have gone or not?
The procedure once you get to hospital?
Yeah.
If we'll get you sitting down for a little while and do what we call pooling. You'll hear it's a common term, and just get you sitting there just for a little while, and then we can have. If it's not an obvious thing, with some girls, we know it's there. They're leaking lots of fluid. We know it's the waters that have probably gone, and if everything else is all right, then we know we can just make a plan. If With any doubt at all, we'll do what we call a speculum examination, where we'll have a little look with a little instrument and we'll guide you through it. It's an unusual thing to have to do, especially when you're not labouring, but it's an important thing to do, that we do confirm whether your waters have gone or not. And even if at that time we suspect they haven't, if it does happen again, you just contact us again, because just because we don't see it at that time, it just means that we've not seen any fluid at that time. So then we would, if it does happen to you again, just ring the hospital again and just say it's a second episode, and we can follow it up.
Julie has a strong, sharp and severe pain in her upper tummy and it isn't going away.
Okay, so do you think that sounds like a normal contraction or labour pain might, from what you're
Not if it's there all the time. If it's not going away, I don't think that would be normal.
Normally, if it's a contraction, it would sort of start, get a bit stronger, and then relax off a bit. So the fact that it's there all the time and the tummy feels quite tense, did you say?
Severe pains.
Severe pains, yeah, and a lot of pain there. I don't think we could think of this as being a contraction. It could just be that she's perhaps had a little bit of bleeding near the placenta, and that it needs checking out. So that is often associated with quite sharp pain, so she needs to phone the hospital as soon as possible. It might be that she has a bit of bleeding associated with it, or it may be that there isn't any visible. So
Gaviscon won't cure this.
No.
I would definitely.
It's not necessarily means there's a problem there. It just means that it's something different. If it's a sharp pain, any pain unusual for your pregnancy, you should discuss it with somebody, and then we can best advise you as to what path to follow.
Anybody else got any questions, or I think that's it. We've finished. So I guess to summarise, hopefully we've given you a bit of an idea of when you might need to contact the hospital and when to go in labour. The main things as far as labour are concerned are your waters going, or if you think your waters have gone, when you're getting contractions maybe 4 or 5 minutes apart, any bleeding, any concerns about movements, they're the main issues. But just any worries, if you're not feeling well, please contact one of the bases or the hospital.